yourself and start your presentation. Just say next slide. We will move to the next slide. Thank you.
Dr. Dimitri, you can Dr. Dimitri, you can unmute yourself and start your presentation.
Okay, hello everyone. I hope this time you can hear and look at me. Yeah. This problem with this communication, unfortunately, we have a little geopolitics problem in my country with another countries, and problem with this is program ape. Yeah. And so doesn't matter. So my topic was about how can you create a new one TMG position by the MRI. Of course, I'm a maxillofacial surgery and I'm a maxillofacial pathology. Not just only one first slide, please. I told you when you can go next. Yeah. I'm a maxilla surgery and maxilla oral pathology too. Usually, I work with TMG, maxilla, nerve, oral pain, and oncology of head and neck. Yes. I look at great presentation by my colleagues, and my topic not so blood, not so about surgery, and I hope you like it. And I hope not all of this great audience, not only just one surgery. I hope the dentistry look at our conference, and I think maybe maxillofacial surgery can understood what I'm talking about and use in those working process this method too. So in front of you, this my method brain muscle joint occlusion. It's a method. How can I? No. Yes, I can treat disorders of brain. In my clinic, we treat patient with oral pain, with this mental disorders, about muscles. I mean muscles, face muscles, yeah, and of course problem of TMG and dentistry and occlusion rehabilitation. Yeah, and my topic, my presentation could be one of part of them about TMG position. So you can show next slide, please. Yeah. Okay. So what about diagnostic of TMG? What the picture of our usual patient with TMG disorders and problems? Of course, they have a pain in the TMG. What kind of tissues feel the pain? Of course, this is soft tissues. Another doctors and my colleagues talked about MRI, and my topic about MRI too. So look at this. This is the same TMG. but one view by the computer tomography, and the same TMG, the view by the MRI. Usually, the simple dentistry who don't use MRI in this walking process, use only computer tomography, look at this and think, no problem, no pain, no click, all parameters they look here in normal. Of course, a little bit degeneration by cortical bones on the top of the head, TMG, but they think, oh, no pain, no problem, and start to do prosthodontics or orthodontics treatment, and after they have a problem. But usually, patients have a chronic problem with no clinical pain or something, another problem. Yeah. But if we use MRI in our work, we can understand where is TMG disc or another problem about cortical on and chondrous part of the head and different. If you can, maybe you can draw on the left MRI picture where is the TMG disc. Can you show for our audience? Yes. Yeah. For those people who can find them. Yeah. Those black part. Yeah. Maybe you can help me. Yes. Yes. Is this a pencil? Yeah. Uh-huh. Ah. Okay. Uh, Unfortunately, it's a little problem. So, if you wanna work with the TMG, of course, you should use the MRI. This is the first diagnostic methods in your arm. But the MRI is just not only one uh, uh, diagnostic method to look at the uh, TMG. This is a method when you use to create a new one TMG position. How can we do that? At first time, you can go next. At first time, next slide, please. From what ape you should looking at your MRI? If you use Apple technology, I mean your laptop working by the Macintosh, you can use free ape Horus. Or if you working by the Windows, you can use Radiant. Uh, those apes work great with any kind of DICOM files. But I'm usually use Irradiant, but because my workstation work by the Windows. But in Radiant or Horus program, you can use any instruments to find parameters to create individual characters to create a new one position TMG by the MRI. So you can choose Horus or Radiant. It doesn't matter what you like. So the next slide, please. Mhm. Yes, yes, please. Can you click and next slide? Okay, thanks. So, what data, what information you need from your MRI? If you're working with X-ray diagnosis doctor from your colleague, You should ask him. You need just only three kind of information data from the MRI. I usually use proton dimension in my work. This is just enough uh, information from MRI. Of course, they can use a different kind of data, but I really think proton dimension is this is the most looking good picture TMG in your walking process. So from the proton dimensions, you can you should need just sagittal view and one coronal view. Just three part of data. Uh, this is can be enough because your diagnosis methods should be fast, cheap, and have low megabytes to save on your walking station. So this is just only free data information what I'm using in my walking. So go next. Go next. Next slide, please. Yeah. To understand what you're gonna find on the MRI, at first time you should remembering the normal TMG anatomy. Of course, you should find fossa, tuber, head of mandibula, condylar, yeah, disc, and muscle. But when you looking at MRI, please next slide. Everything look first time strange, but I think this kind of picture, this quality will be very nice. Yeah, just I think if you look at MRI TMG first time, I hope you still looking and find the TMG disc. Yeah, of course. I think it's possible. Unfortunately, I cannot show you with instruments, but I hope you can find them by yourself. Or maybe, yes, this one. Oh, what's happened? Oh, okay. So, at first time, what you looking at? This is green line. For what you should use that? This is the green line. This is a Frankfurt horizontal line. This is a line you need to use all major instrument to find where is the head and fossa and the space between this anatomical TMG organs. Yeah? So you have this this is a space in front. So from the gynecology or anatomical study book, you will maybe remember from Rudolf Slavicek or Jeffrey Okeson the normal parameters of the high space between fossa and the condylar. This is 3 and 4 millimeters for women and 4 to 5 millimeters for men. But this is a middle parameters of your patient. So how can we should understanding what's the normal part for individual for your patient? Doesn't matter doesn't matter woman this or man how they age, how they tall or short, doesn't matter. So look at here, you have a you can find first anterior part of the condylar disc and the posterior condylar part of the disc. And if they are already equal, you have absolutely normal absolutely normal situation with TMG on your patient. Yeah, it's okay. But if you looking what anterior part of the TMG disc left them anterior, you have a problem. So when you create this line from the orbital and porion, you can create all measure parameters between condylar and fossa space. So what do you need to create individual position? You can use a face bow, for example, face bow by walking by the Frankfurt. A face bow can be companies SEM, Gamma, Gearbach, maybe Denar, or maybe Kava, of course. So when you dress on the head of your patient, this face bow, this is green line you can find on the MRI. And when you put model of upper jaw and fix on your articulator by the Frankfurt face bow and input model of down jaw in reference position, you can in your articulator you can find the same position in your patient, in MRI of your patient, and the same situation in the articulator or variator in your clinic in your hand. And the next, you can use this articulator and you can move down, left, in front, and create those position. What do you need? So how can you create the position of TMG? What your patient need in individual case? Please, next slide. I show you the same situation. And left side, this is a simple situation. Patient have some problem with this and have problem with the TMG. So you can measure anterior part of the TMG disc and first and the up space between fossa and condylar. And this is this between size of anterior part disc and size of upper size of the space between condylar and fossa. This is will be a distraction size to put head of the TMG go down. And next slide. Next slide. Next slide, please. Yes. And how do they look? The same. The size of the first of the size of the anterior part of the TMG should be equal of the high size between fossa and condylar. In the same space should be on back teeth, and all this space on the teeth you should input the splint or another construction in your clinic. in clinical cases. So the next part. Next slide. Next slide. Next slide, please. Please, this is my scientific paper, but of course I write them by the Russian, but you can save this this QR code, and you can look in it, and this is a nice paper, scientific, to use them in your practice. For example, you can find them all kind of measures. I hope you can translate it by AI from Russian for your language. It's not a problem, and you have find mm, any pictures how created step by step. Yes, I hope you save this picture for you. And the next slide. Yeah, this is one of the kind of phase ball. This is electronic phase ball. This is phase ball by company SEM, System Articulation München. This is the usual phase ball, but with electronic part. This is with yellow thing. This is electronic part. You can use this with not just only one SEM articulation phase ball. You can use with gamma, with Amann-Girbach too. So if you need electronic phase ball, you can buy just only this one electronic part of them and input in the gamma and Amann-Girbach phaseball too. So it's very nice, and I think it should be one more nice method in your working case. Maybe you can go next slide. You can find all these clinical cases in my Telegram and Instagram to understand how it's possible. If you want, I can send for you and for all audience a little video site video lessons to how to find the on the MRI TMG fossa condylar disc and how to create this individual position if you want by a little video lesson. Is possible if you want. Unfortunately, I have not enough time, and maybe of course, unfortunately I should finish my presentation, but if you want, I can send you scientific paper or maybe another scientific and video lessons to all audience if you want.
Yes, thank you so much, Doctor, for your awesome lecture. We would like to appreciate you for your lecture and taking out some time. And you are more than welcome to share your paper with us. We will share that paper in the participants group so that they can learn from it, and also the video you were talking about. So we are open for questions. I know it's a bit late here. Participant must be tired, but if there is any question, right now you can ask directly from Dr. Dimitri, or else you can send us in the chat box. He will answer later. So if anybody wants to ask any question from Doctor, you are more than welcome. So Dr. Dimitri, there is a question from Dr. Sana. Can you read it or should I read it for you? इसकी आवाज नहीं आ रही है। अनम्यूट करो, अनम्यूट करो, अनम्यूट करो। नहीं 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 नहीं।
Unfortunately, okay. So I don't use a central position, and I don't use a central relation position. I use a new one therapeutic position, and use the electricity impulse physiotherapeutic method of treatment to create this position, a new one central position. Yeah. So, what's the difference between central position and U1 therapeutic position? Usual centric relation position can damage the TMG. Yeah. And in U1 therapeutic position, have a mechanical therapeutic effect. And after 2-3 months, this is new therapeutic position can be staying a new one central position, but this position not damage the TMG. And all symptom is relief by the mechanical therapy. I mean, the patient should be eat in this in splint therapy, because between teeth and TMG we have powerful connect, and if we don't eat with this, you have no therapeutic or mechanical treatment. So your patient should be eat with your splint. It's very important, and you should create a splint like construction when in what construction your patient can be eat the food, and can eat, can speak, can do everything. So what your opinion? So yes, your patient should be eat in your splint, and and size of the splint, and you can create in your articulator and variator and control by the MRI. I think I should send my video lessons about this one, and you should understand it's much better. Yeah. Because this topic not so well to understanding just by only one presentation with same picture. We need a little more video, you know.
Thank you so much, Dr. Dimitri. I think you have answered all the questions from the participants. But if there are any more questions, you can send us in the group in which you are added. We will send those questions to Doc and he will reply. Yes, you are right. Your presentation was sort of high-level presentation. It needs multiple repetitions and multiple full lecture series, and probably we will arrange it in future with you and more professionals in the future. Thank you once again for your presentation. Thank you. So now we are concluding this session. Thank you, everybody, for being with us. And it was an immense pleasure to have all of you. I know it has been half an hour delay today. You guys must be tired. So now we are just finishing this the summit here. And within next 2 to 3 weeks, we are planning another international summit on oral cancer and oral pathologies and the recent changes in last 5 years. There will be 6 to 8 speakers in this, and it will be announced within a week or two time. So you all are invited to join that seminar as well. And there is a short disclaimer that we were able to record all the sessions, but they will be uploaded on the website within 1 week time, and then you guys can just link it out and watch those lectures. Thank you so much. God bless you all. May you keep serving patients always. Allah Hafiz.